Tonight on Greater Boston, I'm Sue O'Connell in for Jim Browdy. Newly published details from a recent study shed troubling light on the barriers to medical care for people with disabilities. It turns out sometimes the barrier is the doctor themselves. Two researchers behind the findings join me. Then, Shoebert the seal, who stole hearts in Beverly last month, has returned to the North Shore. I'm joined by two experts from the New England Aquarium to discuss his travels and other aquatic news. If you are one of the 61 million Americans with a disability, you likely have a story about the time or times you had trouble getting the medical care you need. And a new study is giving troubling insight into at least some of the reasons, with many physicians indicating a bias against caring for people with disabilities, sometimes even going so far as to discharge them from practices. I'm joined by two of the authors of the study, Dr. Lisa Iezzoni, who is also a professor at Harvard Medical School and a longtime researcher at MGH's Mongan Institute, and Dr. Terra Lagu, director of Northwestern University Center for Health Services and Outcomes Research. I have to say, doctors, for anyone who has had a disability or a family member who's had a disability and had to get two doctor's appointments, this study sort of illuminates and verifies and affirms the experiences that many of us had. Before we get into talking about it, I want to show one stat here about the findings, the survey of more than 700 physicians that was published in January. And the startling statistics here, 36% reported knowing little or nothing about ADA legal responsibilities, 71% answered incorrectly about who determines reasonable accommodations, and 68% felt at risk for ADA lawsuits. Dr. Iezzoni, I want to start with you first. Can you tell me how this survey was done and how you got the additional information from the respondents?
We conducted the survey in 2019 to 2020, so late 2019 through early 2020. The focus groups that Dr. Lagu actually reported on were focus groups that we had done to prepare the survey, to make sure that we would ask the right kind of questions to the doctors to get answers that would be meaningful about their experiences with and perceptions of caring for people with disabilities. And the survey was a random sample of physicians from 7 specialties nationwide.
And Dr. Lagu, what prompted the release of the deeper dive into this information? I mean, we see these statistics, we read them, we think that's terrible, I hope something changes. But when you look at the responses, which we're going to get into more, it's shocking.
It is shocking. And honestly, we reported on the survey because it was really hard-hitting and informative. And then as we went back and thought about these focus groups that had informed the survey questions, we realized that there was a lot of content there that we couldn't ask about in the survey that was revealing and in some ways explained why physicians were making some of the comments in the survey they were making, like that they didn't welcome people with disabilities to their practice. And so when we went back and looked at those transcripts, and there were doctors saying, you know, I feel overwhelmed. I feel like there are too many barriers. I can't care for patients with disabilities. And then in the light of this feeling of overwhelm, we're making some terrible choices that had impacts for these patients. So we just felt we had to write it up.
Let's take another look. The response given in one of the physician focus groups that you're talking about published, this person talking about accommodation. We've gotten to a point in society where a lot of people are wanting some form of accommodation and a lot are illegitimate. They want their pet peacock on the airplanes and whatnot, and that makes it very difficult. You know, Dr. Iezzoni, I spend a lot of time, one of my family members has a disability and had a very difficult to diagnose number of chronic illnesses. And at every given moment that someone would say, well, you have to prove this, you have to prove that, the barriers to getting care or getting accommodations seem to be overwhelming at some point. And then to find out that one of the reasons that may have been, you know, maybe because the physician, he or herself, may actually have a bias thinking that everyone is just asking for accommodations. How do we address that?
I think it's going to be tough because it's basically a societal issue. I mean, the situation with the pet peacocks, really trivializes what the real issues are. And so I think, as Terra says in the paper, that education is needed, training is needed. But the problem from my point of view is that we don't have time to wait. It takes about 7 years to produce an internist, and we don't have time to wait for that to happen because we have growing numbers of people with disability in the country. And so I think that we just need more awareness, like the kind of study that we're doing, to get this information out there.
I want to look at these next two answers too, and talk a little bit about the ADA and lawsuits, which I know isn't necessarily in your realm. Another response from the focus group: a lot of us, me personally, are afraid to treat people with disabilities. You just don't want to deal with them, and that's what the ADA is all about. And then another response: a big problem is not knowing myself what would be the best kind of care, the best equipment for them. I don't even know. I'm not even qualified. Dr. Lagu, I've seen a number of reports, some anecdotal, of people being concerned about ADA lawsuits, and then other people saying, well, if we don't sue, it doesn't change. It's not, going to court is not our number one point, but sometimes there's no teeth in the laws to actually get people to change. And Dr. Iezzoni is talking about education and how long it takes. Is that what has to happen? Do we have to get into the med schools, into the practices, and say, these are the challenges, this is the reality of the ADA, and this is the reality of the patients you have to treat?
So some of it is education, some of it is policy, for sure. If we think about how policy works, payers like Medicare and others set the prices for what doctors make, and doctors feel pinched in a lot of situations. And as a result, adding additional work, like providing accommodations for people with disabilities, is part of the reason that they responded the way they did. It's inexcusable and likely discriminatory. And for that reason, we can't allow it to go on. But the why behind the whole answers to those questions was that we have big system problems in how we deliver care. And the frustration that physicians in these groups were expressing suggests that it's not just people with disabilities. The problem is the way they describe that they deal with their frustration is that they just find ways to deny care to people with disabilities. And the ones that you described were some of them. Others said things like, I don't take your insurance, or you don't have a problem that needs this kind of treatment, or you need specialized care and I'm not the doctor for you. And of course, what's tricky about this is that anyone can call a doctor and ask for an appointment and be denied care because physicians have discretion in who they take as patients. It's just that you can't be discriminatory when you exercise that discretion. And it's pretty clear, although we don't know for sure, because we don't know if these physicians take the patient's insurance, that there's likely some discriminatory discretion happening here. And so really, this is about change on every level. I think it's education, it's culture, it's training, it's reimbursement. It's how do we prepare health systems to care for people with disabilities? How do we let doctors know that people with disabilities are coming and have the accessible equipment in the office, the staff trained, everything available for that patient? And I think there's huge system problems that underlie this. The problem is that faced with those huge problems, some doctors in our study made the right choice, which is to not discriminate, and some clearly made the wrong choice. And that's the big problem.
Yeah, Dr. Iezzoni, it's from my experience, and I'm certain it's not typical, but from my experience, the numbers of doctors that I deal with for my family member are 7. And the 7 are all in the same healthcare with excellent healthcare. I'm not complaining about our privilege of the access that we have, but they rarely talk to each other, and rarely, before my family member gets to the appointment, they read the report, and then, we've got whatever time is left, and then they'll say something like, you need to do X. Well, the patient can't do X because of this illness they have from Dr. A. So Dr. A can tell you why they can't do X, but that requires the patient who also has a mental health challenge to be able to answer that question. And so to this point of the barriers, even if you get in, it seems that the doctors often, and again, not necessarily out of ill will, but just are unable to treat the whole patient. And if Dr. Lagu is right, which I expect that it is correct, how do we start fixing this system so that we are delivering the health care that I'm sure doctors mostly want to deliver to the patients?
Well, Dr. Lagu is absolutely right that it's policy as well. Payment is inevitably an issue in the U.S. healthcare system. And what you're really talking about is coordination, integration of care. It just often isn't paid for. And so this is not something that we specifically addressed in our study, but it is certainly something that we hear from healthcare providers and from patient advocacy groups all the time.
Dr. Lagu, what did you see some of the more egregious things that physicians did or didn't do when it came to treating patients with disabilities?
I mean, some of the attitudes that were expressed were inflammatory to the point where some of our research staff became tearful while they were reviewing the focus groups. I mean, there was a lot of very negative statements, implying that people with disabilities are not worthy of their care, are entitled. It was really inappropriate. And you kind of wonder how this person got to the point where they were saying this, because nobody goes to medical school because they want to discriminate against vulnerable patients. And you just sort of wonder what drove this person to say this kind of stuff in a focus group with other doctors run by a moderator who clearly cares about this issue. And so we were somewhat overwhelmed. And when it got to the point in the focus group where physicians were talking about discharging people from their practice, pretty angry as well. It was hard to deal with. I think the answer for me is that this reflects many of the frustrations and problems that doctors experience working in our healthcare system. This is one of the comments that was frequent was like, well, this is only a few of my patients. But in fact, it's not a few of your patients. It's all of your patients. Your patients are aging, your patients are 9 months pregnant, your patients who have a sprained ankle, your patients who become hard of hearing in their old age. There are so many people who face these barriers and need accommodations. And even beyond that, so many of us have challenges accessing the healthcare system, even if we don't specifically need accommodations. Although care for disabilities is the focus of this paper, the bigger picture is that the healthcare system is broken for almost all of us, and we need answers.
Dr. Iezzoni, what's the response from the medical community been to this report and these focus groups?
This report is pretty new, and so we haven't yet heard much. However, we did have a report that came out in February of 2021 about what, for me, was one of the most impactful findings of the survey. And that was that 82% of doctors think that people with disability have worse quality of life than other people. Only 42% of physicians feel strongly confident that they can provide equal quality of care to people with disabilities. And only 56% of physicians strongly welcome people with disabilities to their practice. I began to hear from some physician and professional organizations that they were pretty shocked by these findings. And it was kind of committing them to an introspective course. They needed to kind of figure out whether their members of professional associations also felt this way. But I don't know how far that has gone.
Well, we will have to stay posted on that. I appreciate both of your joining us and the work that you've done on this issue, and look forward to reading more and learning more. Thank you, doctors. Thanks for joining us.
Thank you for having us.
The arrival of fall has most of us shying away from the beach these days. Apparently, even the sea life. Shoebert the seal, who drew crowds when he showed up swimming in Beverly Show Pond last month, has returned to the area. Now, back in September, the gray seal was brought to the England Aquarium after turning up in the pond, and after evaluation, re-released off of Block Island. But it looks like he just couldn't stay away for too long. Researchers tracked the seal just yesterday to the entrance of the Danvers River, perhaps, possibly looking to see some old friends. To discuss the motive, perhaps, behind Shoebert's return and other aquatic news, our New England Aquarium senior mammal trainer Terra Wilson and curator of pinnipeds and penguins at the aquarium, Kristen Van Oss. Welcome to both of you. What do you? We don't want to get in the mind of Shoebert. We can't speak for him, but what do you think is happening here?
So gray seals tend to kind of hang out all in the North Atlantic Ocean, so it's not really surprising he went back to the same area, especially if he found a great fish source there. It would be a little unusual if he headed back to the pond, but maybe not shocking if, again, there was a great fish source there. They're incredibly intelligent animals.
And, you know, Kristen, we always kind of, put our own human feelings on the animals, right? And although we're learning more what feelings they actually have in their own right, I was amazed how people just started telling these stories about him, like, well, he went to the police station for help as if he could read, and we just expected him to go back out to the ocean. But, some of this behavior, if we weren't able to track it, has probably been happening for forever, right?
Yeah, definitely. So again, like you said, we don't know what they're thinking. He didn't necessarily go to the police for help. It's a kind of a fun story, though, and it's been a great way to kind of be an ambassador for his counterparts in the wild, get some spotlight on him, and everyone can learn about gray seals.
Right, and we're also trying to make sure people know we're trying to keep people away. I was fascinated by some of the coverage of this too, the recent coverage, talking about presenting it as if there's a line between wildlife and sea life and human life, and as if Shoebert has somehow crossed that line, as if we haven't, as if there is a line, and if we don't cross it on a regular basis. What lesson is there here for us to learn about where we live and where they live?
So again, I think it's just a great way for us to learn about gray seals. We do try to tell everyone to keep a distance from them. So we say about 150 feet. They're going to venture into our areas. So big news stories lately are how, they're taking over our beaches and things like that. And I think we can share our spaces together safely as long as people can respect them. They are wild animals. So if you keep your distance and just be curious about them.
Kristen, has the ability to track and gather data? I mean, I know over the summer we had some news about, I believe it was a dolphin, and because of a camera that was attached to him, finding new ways in which he got his dinner, which looked more violent to people than they expected, I think, dolphins or porpoises to behave. And we've got news about the killer whales that seem to be mauling great white sharks out in the ocean. And that's something that seems to be news to us. Is this opening a broader window for how wildlife and animals behave? What are we learning from all this?
Yeah, that's really interesting because having animals in zoos and aquariums is so helpful to learn more about everything from their dietary habits to their physiology and their personalities. We learn so much about them. And I think a lot of people think the great white shark is the top predator in the ocean, but actually it's the killer whale. The killer whale is so strong. They're the top predator, apex predator in the ocean, and they eat a variety of different things from marine mammals to different types of fish, including great white sharks. And there's different ecotypes of killer whales as well, which is different groupings of animals that feed off of different types of prey and also live in different parts of the environment. And we have seen that off the coast of South Africa, there are some killer whales that will actually go in and kill great white sharks, and selectively they'll eat the liver. That's accounts for about a third of the weight of the great white shark. So it's a big delicacy for them, and it's full of nutrients and fat. Then there's other killer whales that'll prey primarily on salmon. And then there's also whales that will eat seals and sea lions. So all kinds of marine mammals. So it's really interesting, even within them being the same type of animal, the different dietary habits based on where they're living in the environment.
Kristen, are you feeling that we might be at a point in society, especially here in the New England area, where we're learning we get all this data. I keep focusing on this because I feel like it's been happening forever, and we just suddenly are seeing it, right? And we're processing the data, and these reports about how many sharks there are along our coast, where, you know, experts like you may say there are more, but we also have cameras now and phone cameras, and we're posting about it and we're tracking them, and we've got this bulk of information that leads us to conclusions that are not new, they're just new to us. But do you think we're at a point now where we're starting to understand that we all share the same space? Like, we share the water with the sharks, we share the ocean, we share the coyotes. I know that isn't your wheelhouse, but the coyotes live with us?
Right. I think you're right. We're learning so much more through the drone footage and research, and technology has taken us so far that we can see how close sharks are to surfers or swimmers, and it can be alarming at times. And, you know, sharks don't naturally go out trying to eat a human being. It's just when we look like something that might be a normal prey item for them, like a seal, like someone might look on a surfboard. But I think you bring up an excellent point that there has to be that healthy balance of sharing the environment. And, you know, this information also brings up the ideas of conservation and really taking care of the environment so these animals can thrive both in their natural environment and in zoos and aquariums. So I truly believe the knowledge we gain from the animals in our care really helps to carry that message forward. And that, coupled with the research that you're talking about, the drone footage, or being able to train animals to have a camera on their back so we can see what's going on in their aquatic environment, is key to keeping it a healthy environment for them and for us. But it's always important to remember, whether it's a gray seal or a killer whale or a shark, you know, they're wild animals and they can be very unpredictable. So there needs to be that healthy distance that Terra mentioned between humans and animals that are in the wild.
Yeah, you can't often talk down any kind of animal. I have a relationship with a squirrel at my house, which I'm sure is going to go south at any minute with me on the receiving end. Terra, when we look at mammals like Shoebert, and again, I want to get back to what we project on what they're doing. What are some of the behaviors that you experience every day that we might think are the animals acting like humans, but are actually more like we humans are acting like the animals we are? What kind of shared behaviors do we have?
Yeah, that's a great question. So all of the animals that I work with, they definitely have different personalities. If I had to compare them to an animal that you guys are familiar with, they're very similar to dogs in a sense. They definitely have their own personalities, and we can read into that. So they have different toys that they might find really reinforcing between each other, things like that we can see, and that we might apply emotion to, but that, you know, it's just a part of them.
Do you give them names based on what you think their personalities are?
Not usually. So we tend to name them. It can be a variety of different reasons. It might be a name of an area that they're from originally, or maybe where they were stranded. So our northern fur seal, Luna, we named her because she was found on Laguna Beach, and so we shortened it to Luna. So different reasons come into naming factors, things like that.
Kristen, we're seeing also a lot of reports of sea life being tangled up in fishing gear, again, something that's been happening a long time. Are there any efforts that you're aware of for ways to help keep the fishing industry healthy and working and diminishing the opportunity for harm to the wildlife?
Yeah, I think that's a really important point that you bring up. And we all need to work together on that project to make sure we have sustainable fishing in addition to safe practices. You know, it goes hand in hand with different industries that will rescue animals that are entangled. And you even see people in the public now reaching out and helping if they see a whale tangled in a net, untangling them and getting involved in that, which can be dangerous. So really professionals need to help disentangle an animal if they're caught up in a net. And it goes down to just following the regulations that are set up to protect the environment and to protect the animals out there with the type of equipment that can be used without having that harmful effect on marine mammals, fish, anything in the ocean. And also kind of keeping those regulations in check and following through with that and keeping our oceans clean. It's really working together. And that's where the aquariums and zoos have that messaging where people are learning about what's going on with overfishing or the pollution in the ocean and how we really need to take a look at that. as a team effort, as a globe.
I'm talking
global effort.
I'm talking a lot about how we're getting used to understanding we live with the animals and mammals and sea life, but we're also looking this summer. We saw a number of times where juvenile whales were having a heck of a time and didn't seem to care so much that they were around humans. We saw whales crashing onto boats and getting out of the way, it seemed, just at the last minute so that they didn't hurt anyone. Are they getting more accustomed to us as well, do you think?
Well, they do get accustomed to us, or they get desensitized to all the activity because there's a lot of tourism, there's a lot of boating going on, and that can be problematic as well because animals can get rammed by boats and be injured or killed in that way. So again, as Terra mentioned, and it's important to maintain our distance. Even when you're out on a tour, whale watching, whether it's killer whales or dolphins, maintaining a certain distance is required, and it's important because if they become too accustomed to humans, it affects them in a negative way. They get too close to boats, or if people feed the animals, whether it be a marine mammal or any other animal that you're not supposed to feed, like a squirrel is a good example as well. They get too comfortable with people and they could be aggressive at times. So you have to be really careful. And we want them to be able to be out there foraging and hunting and keeping that ecosystem in balance as it was meant to be. So it's important to keep those guardrails up and yes, view the animals and respect them, but also maintain that distance.
Well, I think Shoebert has figured out the influencer's route here to a money-making career and maybe fast on the way to become our state mascot. You got to give him props for that. So Terra Wilson, Kristen Van Oss from New England Aquarium, thank you so much for joining us. That's it for tonight. Well, almost. There's someone else who wanted to add a quick word before we go.
You probably didn't expect to see me tonight, but I had to make a brief appearance for a very important reason. Tonight is the last night our director, Rob Fagnan, is doing this show. He's leaving GBH, and what a loss. Now, this is him holding an Emmy he won for the Beat the Press anniversary show. I'm pretty sure I was nominated too in that category, but did it damage our relationship? Well, regardless. Much of the last 2+ years has been pandemic TV. And looking back on the worst of it, I remain amazed that we made it on the air every night. But that group behind the cameras performed magic, with Rob never buying that the impossible was impossible. Here he is in the control room just a couple of weeks back. The producers assure me there was a reason for this, but I've learned not to ask too many questions. Smart, creative, relentless, crazed, viciously funny. A lot of talent crammed into a really good guy. So thanks for everything, Rob. And as for the Emmy, you know me, I am not the kind of person to hold a grudge for long.
Good luck, Rob. Now, that's really it for tonight. But come back tomorrow for Talking Politics. Adam Riley and his panel will take up the case of a Cape Cod man who died by suicide in a Bristol prison this weekend and the troubled state of mental health care for prisoners. Plus, did Democrats underestimate the Republican Trump supporter trying to oust New Hampshire Senator Maggie Hassan? That and more tomorrow at 7. Thanks for watching.
Next time